very good morning to you. It's good to see you on this 23rd day of October. And of course, we're still continuing with our series as far as Breast Cancer Awareness Month is concerned. So I hope that you'll stay around until the end of the conversation, because today's conversation is more centered towards surviving cancer, because we have done a lot of conversations on breast cancer in itself and of course the impact that it has, but we want to look at on the other side of cancer, all right? And this is life after cancer diagnosis, and also for those ones who have been on remission, what is life like, finding meaning, finding purpose as well. So like I said, you want to stick around because my panel today, very, very able panel, who are here to share their stories and share their experiences as well as far as surviving cancer is concerned. But we also have Dr. Ferdinand Wanjala Nangole, who's the president, Kenya Society of Plastic and Reconstructive Surgeons, as well as a senior lecturer and thematic head of plastic surgeon from the University of Nairobi. Long title, but he'll help us really understand. So on the other side, right, after cancer, after, the treatment and all those things, so then what happens, and especially for, for those women who'd want to do reconstruction, right? What exactly does that look like? I see you have props over there. So Dr. will help us really understand what, that is all about. And if you decide that is because there's some women who would rather not. So we'll look at all those dynamics as we continue with the conversation. Dr. thank you so much for your time this morning. We also have Sophia Wambui Kiarie, who is a breast cancer survivor, and you're only 26 now. So,
yes.
26 years old. Good to have you this morning. Thank you so much for, first of all, agreeing to come and speak with us as far as your experience is concerned. So really, really, really appreciate that. And you did reconstruction, right?
Yes.
And it's a very unique, but Dr. is here to tell us all about this, because most of the time when we think about reconstruction, we think about implants, but there's also other ways of doing reconstruction. So we'll hear from you, Sophia, and Dr. as well. And joining us via Zoom, not a new face, I'm pretty sure you know her very well. We have Bwire Ndubi, who's a founder, Bwire Warriors Foundation. She's an actor. She's a cancer survivor as well, joining us to also share her story as well. And that is as far as finding meaning and purpose. And this is after cancer diagnosis. So good to have you this morning. Thank you so much for joining us. I mean, listen, she's my namesake, okay? So when I call you Winnie, it's like, hey, how are you? And you're also joined by your mom as well. And that is Mrs. Stella Auka, who's an entrepreneur and a founder in This Is Broad Range Enterprises, but also a breast cancer survivor, as well as a motivational speaker and trainer as well. So Mom, it's good to have you as well. Thank you so much for joining us. The color coordination going on very well. We see you too. But it's so good to have you too as well, joining us and sharing your story. But Dr. very quickly, can we just talk about the breast cancer trends, especially here in the country? Like we said, Sophia is very, very young, got her diagnosis when she was only 22. Yeah. Okay, and then went through, the whole course of treatment and whatnot. So what are some of these trends that we are seeing right now? I know our focus mostly will be on life after, but what are some of these trends that, you have seen over time?
Yeah, thank you, Winnie, for first inviting us
to
this very, very important show
yeah.
of what after breast cancer treatment. To go straight to your question, yeah, the trends, one is that we are getting more cancer patients than we used to get. Not only breast cancer, but even other other types of cancer. And this is not only a Kenyan problem. This seems to be a global problem. That more and more cancers are now being identified. We don't seem to know the exact reason why that is happening.
Okay.
As far as the cancer itself is concerned, we seem to get younger patients with breast cancer, like Sophia. She was diagnosed when she was only about 22 years with breast cancer. And that the younger the patients that seem to get the breast cancer, the more aggressive the disease seems to be compared to the older patient. So it's raising a lot of concerns. And of course, you know very well that one of the most important organ in any woman, a sign of femininity, is the breast. So you can imagine when a 22, 23-year-old female loses her breast, then obviously it has a lot of psychological impact on her. And that is why I think we're having this discussion. Thank you.
Very, very important. We cannot sit and say, no, women who are slightly older, are more at risk. We're also seeing, again, like you're saying, a very, very big concern. And this is increasing number of younger patients. But also what you're saying is the cancer is very aggressive. Do we know why the aggression or still?
Well, there's still a lot of research, a lot of theories, but I'm not very sure we know exactly why that could be happening.
Okay.
That we seem to get a more and more aggressive form of cancer. But on the other side of it is that for the breast cancer, there's a lot of advancements in the treatment of breast cancer. So if it's gotten early, then we are able to treat it. And in a good proportion of the patients are able to live a normal life.
Okay, yes. All right. And that's the most important
that's the most important thing, yes.
I see that. Yeah. Okay, let's speak to Sophia. Sophia, 2019, one morning you felt a lump in your, is it left armpit or was it the right?
Left.
Left, okay. Let's go back then. 2019, only 22 years old, you're full of life, and then you feel a lump. Okay. Yeah. Do you want to take us back?
Yeah, I had just graduated, so I was just preparing myself, like waiting for what is ahead. Actually, I was going out with my sisters for a party because I had just graduated. Then I felt something. I have history with breast cancer because I have a relative we had lost a relative. So when I felt the lump, I went to hospital, obviously, because I knew how it goes when you feel a lump because of my aunt. So when I went to hospital, it wasn't a hospital, it was like a clinic. They told me, when I went to the clinic, I felt like it was more of, they told me it was considering I was on my period, it's not likely to be cancer. It's maybe just because of the period thing.
Yeah.
So when I went, the doctor was like, you know what, Sophia, do this. After 2 weeks, when you feel don't come back. Go to a more advanced hospital. Okay. When I went to the most advanced hospital because I definitely went. And it was like it's growing or something. And the doctors were like, you're so young. How can you get cancer? How can you suspect cancer? That's impossible. Yeah. They said it was hormonal imbalance. And they were like, hey, Sophia, people have bigger problems.
Okay.
In that hospital. So, but after some time, I decided to take a second opinion. But then I had started working. So, and then corona came. So I was like, I chose to go to another hospital. That's where I met a doctor who was like, by the way, this is a big lump. Because it had started being painful. They did a biopsy. Yeah, that's when they diagnosed the tumor as cancer.
Okay.
Yeah.
All right. And Dr. do we see this a lot very quickly before we speak to again, Bure and Mom? Do we see this a lot? Because again, so go to the first clinic, and again, we can understand maybe not well equipped to do such tests. But that assumption that number one, you're very young, so you cannot have cancer. You go home, and again, like she's saying, she told we have people who have more serious problems. You go home, this is not cancer, so hormonal imbalance and all those things. Does this then make it difficult to get cancer at a very early stage, so that treatment begins earlier? Assumption and ignorance that what, you're very young, you cannot have cancer. Yeah.
It's very, very true. It's a problem. It's a problem that we encounter, that sometimes the patients, the first facility that they go to, sometimes are not given the right direction on where to go for subsequent management. And because of that, then you get delays in the diagnosis of the breast cancer. So one of the messages that really needs to come out very clear to all healthcare providers is that any suspicious lump, any breast swelling must be treated as suspected to be cancer unless proven otherwise. And the only way to prove that is by having some form of histology, like she said. So we should never make assumptions that this patient is young. We get cancer in very, very young patients, unfortunately. And there's no way you can prove that this is cancerous or this is not. And the only way is for, if you're not able to do those tests, then refer them to a center where those tests can be done.
Okay.
Yes.
All right. Have like a higher index of suspicion. Okay. All right. Do not ignore. Okay. Let's speak to Bwire. More or less the same, and this is as far as, you know, but a little bit different, if I can say that. So you had a swelling in your armpits, right? And again, one of the things that, of course, you feel, you know, as a woman, you're like, okay, fine, what exactly is happening here? Was cancer your initial thoughts, you know, when you felt the swelling, or what exactly happened by the time you're getting your diagnosis?
Actually, I got, my parents used to take me for mammography when I was still young, because I had lumps when I was around 13. And of course, we were scared, but they were monitoring them. And when they were, when they took some, when they did the mammography, they discovered that the lumps were benign. That means they were not cancerous. So they've been monitored over the years, but 20-something years later, I get my period and my right underarm starts throbbing. And then my period disappears and the pain goes away. So of course, as women, we associate any kind of pain that we get during our period with the period symptoms. And then the next month, my period comes and the pain comes underarm. And I'm like, no. I go in, I see a general practitioner. She examines me for breast cancer. And I tell her about my history, about cyst in one breast and, a cyst and a fibroadenoma in the other breast. But they have not been malignant. They have been benign for the longest time, for over 20 years. And she examined me and she says, honestly, you have nothing to worry about. This doesn't look cancerous. It just looks like maybe you have an infection in your lymph node or something. So she gives me antibiotics and some pain relief cream. I go home. In the next month, the pain comes, the period comes, the pain comes, and the period leaves, and this time the pain stays. And that's when I knew something is definitely wrong here. So I called mom, and she said, I think you should see a gynecologist. So I go in, I see a gyna, and he did not even last 1 minute with me. And he told me something is terribly wrong. He sent me scans. I did a whole lot of them, from ultrasounds to mammograms to CT scans with contrast, without contrast. And finally, they took a sample from both my breasts and sent them into the lab. And when the results came back, it was positive for cancer.
Okay, and it's a different dynamic, because for mom, it was a totally different type of cancer, but hers were diagnosed early. So mom, do you want to take us through that? Because these are two different, and I'm happy that you're together, because now you're giving us different perspectives, but also how much of support you are able to give each other, you know, during this moment. But for mom, can we go back to your case? When was your diagnosis?
Thank you so much, Amy, for having us. My diagnosis was in 2015, September, and I was just having a bath, and I realized that beneath my breast, one of my breasts, there's a small lump. Then I thought, oh, it was because I was in my periods. I was 51, but I still had my periods. So after the periods, I was just showering again, and it was still there. I wondered, like, now my periods are gone, and this thing is still here. It was not even painful. So I told my husband to check after bath, and he checked and he said, yeah, it is, I can feel it, just go in for rest. I took some time to go because I was not in a hurry, it was not painful. So he was on my neck, like, why aren't you going? Then I said, I wish I could have told him this. Now he's on my neck, so nothing. But eventually I went, and when the doctor looked at me, sent me for the needle tests and scan. It was the scan first. Then when it came, they told me to go for the needle test. Then after that, they told me to wait for about 3 days, but they called me. I had gone to the scan. They called me earlier. And the surgeon now was telling me that, you see, I have to see which one do you want, the bad and the good, which one do you want to come first? I said, bring the good one. So he said, the good news is that you have cancer stage 1, the bad news is that you have. I was looking at him like, you people, hey, I am not cancerous. Cancer is not for me, it's for the other people, those unhealthy guys.
Yeah.
So I never listened to him. I went away. I was wondering, like, is he looking at my insurance card or what? So after that, I stayed about 3 days. Then I went for another opinion. And this surgeon also said, this one is too big. If it were me, I would have removed my breast yesterday. So I had to go back to the original one, and I asked him, what were you saying?
Yeah, yeah.
So he told me and I understood everything. And actually, I was booked in that week, and I said, no, I'll wait until the next week. Let me digest the news first.
Okay. All right. And I see that. So Birre, for you having to see your mom, first of all, going through this process, and yes, she again, her diagnosis, they got it at stage 1, and she was, put on treatment immediately or almost immediately. But for your case, again, like you said, at the edge of the cliff, literally at stage 4. I'm just curious to understand, what was that process like for you? And of course, there's so much that happened in between, but today we're focusing mostly on life after, and this is surviving cancer. You're still going through treatment, if I'm not wrong. So what is that like, finding support, first of all, for one another? And we'll also speak to Sophia as well, as far as that decision to go for reconstruction. But we need to take a break right now. There's so much that we need to cover, but let's just take a break. And then when we come back on the other side of the break, we'll get to understand. So then, what was that process like, for both Sophia and Birre and Mom as well, and especially your decision to go for reconstruction. Can you tell us, all the different types that happens if someone is watching us and considering the same. So there's so much to discuss on the other side of the break. Stay with us. The show is Your World.
There's a lot going on at the moment in this house.
Their true identity is uncovered in the brand new unmissable Zari. Starts 23 October, only on Maisha Magic Plus, channel 163 on DSTV Access, GoTV Plus, channel 3.
Candace, what's that?
I brought you a small bonus.
Bonus for what?
You got us 299 family dinners, 64 kisses on the cheek, 12 road trips to see grandma, 42 jokes from daddy, 49 laughs from mommy.
In over 60 years of dealing with numbers, we've learned that the numbers that matter the most to you are the ones that matter the most to us. NCBA Bank. Go for it.
I'm Engineer Peter Njenga, Managing Director and CEO of KenGen. I'm excited to announce my participation in the upcoming ManCave 3rd edition. I'm eager to engage with fellow men, sharing insights and learning from one another. Personally, I'm passionate about engaging our youth in matters of career growth and family. KenGen is delighted to work with Nation Media Group on this valuable initiative as it aligns with our vision of nurturing holistic individuals. I eagerly anticipate your presence at this event, and together we can inspire and shape a better future for ourselves and the community.
Reach your audience instantly and make a lasting impression with Nation Sema. Affordable SMS at 0.3 Kenya shillings. Own sender ID for 10,000 Kenya shillings plus 10,000 free SMS. To sign up, please call 0790 111 111 or email us on nationsema@ke.nationmedia.com.
All holders are notified to report and surrender unclaimed financial assets to the Unclaimed Financial Assets Authority, UFAA, on or before November 1st, 2023. Visit www.ufaa.go.ke and get started.
Welcome back. The show is Your World, 34 minutes past the hour. There's so much to cover as far as our topic of conversation this morning, and this is as far as, yes, continuing with our series on breast cancer, but today we are taking a very special focus on surviving cancer, and we're looking at life after cancer. And like we said, after treatment, after remission, there's some people, some women, since we're focusing on breast cancer today, and like we said in the last episode, men also can get breast cancer, but majority of diagnosis is usually made in women. All right, and there's some women who, and especially after mastectomy, some would rather not have reconstructive surgery, and others would choose. So the big question is, so then what are some of this? First of all, what exactly does that look like as far as reconstructive surgery is concerned, and what are the different options? And that is why we have Dr. Ferdinand Wanjala Nangole this morning, who's the president of Kenya Society of Plastic and Reconstructive Surgeons, and he's also a lecturer, okay, at the University of Nairobi, to help us really understand what the process looks like as far as reconstructive surgery is concerned. But we also have Sophia, who was diagnosed with breast cancer. It was at stage 3. Mom, and that is Mrs. Stella Auka, who was diagnosed at stage 1, and we have Bwire. We all know her, okay? If you watch on local television, you know her, okay? For her role, and she was called Dida. And this is from on the show Sultana, all right? So she was diagnosed again at stage 4. And Dr. I'm mentioning this because a lot of people would be scared. First of all, the name itself, cancer. We do not want to hear it. We do not want to talk about it because it's just scary, all right? Yes. But then to get this different, diagnosis, and especially stage 3 and stage 4, what exactly does it look like at that time, and what are the treatment options? We'll talk about mom in a second, because she was put on treatment almost immediately. But stage 3 and stage 4, what exactly does it look like? Okay,
the higher the stage, basically the higher the stage means the more advanced the disease has been. Okay. And the lower the stage means the less advanced the disease has been. With the higher stages, stage 3 and stage 4, that mainly means that the cancer has been in the breast and it's big, and probably because of that, it might have involved the lymph nodes, especially in the axilla. And for the stage 4, sometimes it means it has already spread from not only the lymph nodes, the axilla, but also gone to the rest of the body, sometimes into the bone, the lung, and other areas of the body. Okay. So the implication of that in management is that even after surgery, the patients may still require other treatments like radiotherapy and chemotherapy to try and assist in clearing the disease. Yes. Okay.
Yeah. All right. And for stage 1, so then what exactly does that look like?
Yeah, the stage 1, the nice thing is a very small cancer, about less than 2 centimeters, localized in a small area of the breast. And the beauty of that is that it can be removed In many cases, you may not even need to remove the whole breast, but just part of the breast will be removed, and then the reconstruction is offered for that part of the breast that was removed.
Okay. All right. I'm curious to see, Mom, is that what's happened for you as far as treatment?
I was given that option, but then I decided to remove the whole breast because being a small person and having small breasts means that if we removed a bigger part, they had told me they'll remove a bigger part just to rule out the chances of it maybe spreading or tampering with the other tissues. So I decided just to remove the whole breast. And thereafter, I was given 4 rounds of chemotherapy. And then thereafter, I was given onto oral because the kind of cancer that I had was estrogen positive. So they put me on oral therapy or on tamoxifen.
Okay.
Yeah. Which I was supposed to take for 5 years or 10 years.
Okay.
But then
all right, but then
I changed along the way.
Okay, why did you decide to change?
I changed along the way because on tamoxifen, the drug that I was given, it had been written on, it can cause an ovarian cancer.
Wow,
so I was concerned, but I raised with my doctor that how come I'm running from breast to ovarian? And then he said that it's just as 5% population that can get. So I'm saying, if it's only 5, how come? Or how do I know that I'll not be among the 5? So along the line, I just changed. I tried to draw and know, like, how come I have this thing and yet I've been a cautious person all along my life. Then I zeroed into the things that I used to do. So I stopped doing those things. Not that I was doing very bad, but I was taking a lot of milk, which is very acidic. Then I was having a lot of meat, not a lot as a lot, many times. That is what I mean. I was either eating red or white. All the time in my dish, there was a meat somewhere.
Okay.
So I did away with that. And then I changed my lifestyle totally.
Okay.
To totally vegetarian for about 6 or 4 months there. Then thereafter, I could cheat once in a while, but not more often.
Yeah, you're very, okay. All right, and your concerns are very, very valid, really, you know, at the end, because you can imagine that journey moving from, you know, surviving cancer and then this other risk. So again, the concern is absolutely very valid. Dr. will speak on the same a little bit, because there's so many people who might be watching us and thinking, okay, what if the risk is there? What is it that I can do? What are some of these options? And before we leave Mombasa, because we're in Mama joining us all the way from Mombasa. So Bire, for you, you had a different type of cancer. Your diagnosis was different from Mom, because yours was ductal carcinoma in situ. Okay. So your treatment, I mean, I listened to you and you said you had done a lot of Googling and you knew that what you were supposed to do is radiotherapy, but then you were told you have to go through chemo as well. So very quickly, just take us through your treatment journey as well, because again, you said you used to speak to your breast and say, listen, you are going to stay intact. You're not going anywhere. Take us through that journey for you.
Yes, I believe in words of affirmation, and I believe when you cheat your brain, it can cheat your body to do anything it is you want it to do.
Yeah.
But my treatment plan basically was, I did 8 rounds of chemotherapy in the hopes of shrinking the tumor. I Googled a lot because I was hoping that I would get to do anything other than chemo, because I know about chemotherapy, its effects. I've seen what it has done to my mom and other patients out there, and I was dreading chemotherapy. And Google was telling me, which is true, if you have a lump that is smaller than 2 centimeters, they perform this procedure called a lumpectomy. Medicine has come a long way, so I was expecting they're just going to put this vacuum thingy in there and suck out the lump, and then I was going to go straight into radiotherapy, according to my brain. But the tumor apparently was bigger than 2 centimeters. It was about 4 centimeters in one breast. So I did not even go through surgery first. They couldn't operate on me. They had to try and shrink it. And after 8 rounds of chemotherapy, they put me on target therapy.
Okay.
And the particular target therapy I was put on was because the ductal carcinoma in situ diagnosis I got was not an invasive one. It's not even an aggressive type of cancer. So to get to the 6-month period where I'm supposed to do my PET scan, do the routine check, because they have to keep monitoring are the cancerous cells going down in numbers or they are multiplying in numbers. So I go in for my PET scan in the hopes that I'm going to get good news, of course, because my body has been feeling good. I've been working throughout my treatment plan. I've never been admitted or bedridden a day since diagnosis, so I was doing really good. But on the day I was going to do my PET scan, I started throwing up, losing my balance, losing my vision, and I'm thinking to myself, something is definitely wrong. This is not normal. And I thought probably it was medication or I had some sort of infection. So I tell the nurses who are performing a PET scan on me, and they say, don't worry, we're going to have it checked out. And so they do a PET scan, and I get my results after 2 days. It clearly states that I have a lesion in my brain, basically a tumor, a very small one. But it literally led to my life going downhill within the shortest time possible. Now, this thing put me in bed. And I had to start the process of treatment instantly and stop the kind of treatment it is I was getting for my breasts, because the one in my brain was posing more danger to my life. And the scans also indicated that the disease had spread from the primary breast to the other breast and the bone in between the breasts.
Oh, wow.
And I'm thinking, I've been on treatment, I've been doing everything, I've been on diet. What am I not doing right? And sometimes the disease just doesn't listen to treatment. And so what you need to do is totally alter the treatment plan, which is what the doctors did for me. I got 10 rounds of radiotherapy to my brain, and that stabilized me. And now I'm back on target therapy, just a stronger version. As we're discussing other modalities of how we're going to get rid of this situation.
Okay, all right. I mean, I can only imagine, I can only empathize, because it's a lot. I can only imagine how, you know, that sort of like altered, like you said, your life in different aspects. And Sophia, again, your case is more or less the same as Bria's, in the sense that the tumor also moved from the primary breast to the other breast as well, right? So do you want to take us through, again, that moment for you and the treatment options? Because, yes, you opted for mastectomy. And I'm trying to imagine how difficult a decision that was, because you were only at that time, what, 23, right? Yeah, thereabout. And you have to have your breasts removed. Yeah, I can only try to imagine how that was like for you.
Okay, my treatment plan included the chemotherapy. Then after chemo, you do surgery. Then after that, you do radiotherapy. And then you do hormonal therapy. Hormonal therapy is there. You do. And it's not tamoxifen, it's doc.
Yeah, it's tamoxifen.
Yeah, tamoxifen. Yeah, right. So, and then as I was continuing the tamoxifen, the doctor decided that I hear something on my other breast. Then I was like, okay, I did not tell anybody in the house. And on my next clinic, I went and told the doctor.
All right.
The doctor was like, by the way, Sophia, there is something. And then I was like, I wasn't surprised as much, because I was like, they had said the cancer had advanced to stage 3, so that was not much of a surprise to me. So when they did the tests, they did the CT scan. It was found to be, but it was stage 1. This In the left stage, in the left breast, it was stage 1.
All right.
So they continued with, they did the treatment plan all over again. But in this case, as they were concluding the cancer, the treatment, they decided to involve other doctors, the reconstructive. Yeah, the reconstructive surgery.
All right. Yeah. Okay. Yeah. So how were you throughout this whole process?
Okay, there's this part where you go down.
Okay.
First of all, you don't believe it.
Yeah.
Okay, at first, I couldn't believe it. Like, there's this part where you feel as if the world is coming to an end, because I mean, I had just gotten when you are diagnosed, I had just gotten a job.
Yeah.
But because of COVID, I had to stop working.
Right.
So for me, COVID was like a plus, because we were not working.
Yeah.
So I had to focus more on my medication.
Okay.
Yeah.
All right. Okay.
So, yeah.
I mean, yeah, okay, I can only imagine. And then you see at that time, there's so many things that are happening. And then you also have to deal with, your treatment and, all those things. And the different treatment modalities were more or less the same. And like you said, one of the treatment options that also Mom went through is mastectomy, same as Sophia. So do you want to take us through what that is like? And like you said, you have the implants over there. So and again, like you said, this is as far as reconstructive surgery is concerned. Yeah.
Yeah. Thank you once again. Yeah. So like we said, once the tumor is in the breast, surgery is one of the main treatment modalities.
Okay.
And one of the most commonly used surgical option is to remove the whole breast. In her case, the left breast, the tumor was small, and she was given an option of either just remove the tumor or remove the whole breast.
All right.
But because of the family history of the breast and the other breast, it was decided that the whole breast is removed. And then, of course, once the mastectomy is done, then the psychological aspect of the breast cancer comes in. Because as you all know, breast is a sign of femininity. And for any woman of any age, worse off for the young women to lose the breast causes a lot of psychological trauma. Because she cannot go through her life without the breast. And that is now where we come in as reconstructive surgeon. So one of the mainstay of treatment of breast cancer is actually breast reconstruction. And actually World Health Organization specifies and actually affirms that breast reconstruction must be considered as part of the treatment of the breast cancer. So when you do not provide breast reconstruction for your patient, then you are doing a disservice to that patient. And as a doctor, you must explain to the patient the various options of breast reconstructions. And then the patient will decide whether she wants to go on with the reconstruction or she doesn't want to do the reconstruction. But you must provide and tell her, yes, we are going to do mastectomy, but after mastectomy, these are the options that we have for your reconstructions. So what are the options? There are basically broadly two types of options for reconstructions. There are what we call as implant-based reconstruction. And this is just how the implant looks like. Most of them are silicone implants. So they have a gel which is made of silicone. But some of them have saline. Saline, just salty water kind of implants that you can use for the reconstruction. So that once the breast surgeon removes the breast, then he gets as the plastic surgeon to come and assist and put this implant into the breast. And these implants, once it's put where the breast came out from, it has got the same feel like the breast. And actually, to the ordinary person, he or she may not be able to know whether that is the normal breast or that is the replaced breast. Then the other option, like what we used for her, is using her own tissue, using part of her tissue. And for that, there are many options that we can use. Right. But one of the commonly used option is the tissue just below the umbilicus, which basically what we do is we raise the tissue, which basically has skin and the fat, and with the blood vessels. We call it DF flap. For those who may want to check about it. Right. And then basically what we do is we raise that those particular parts of the body, and then we use them to mold it into the breast. And then we use it for the reconstruction of the breast. Okay. If the defect is not so big, we can borrow tissue from the back, or even we can borrow tissue from the remaining part of the breast, especially for those patients who've got large breasts. That only part of the cancerous part of the breast is removed, and then the normal part of the breast is used for the reconstruction of the breast.
Oh, I see. Okay.
And my experience has been that once you do that, actually the patients are very, very, very happy. And they feel like you've given back. Like Sophia. Yeah. Anybody looking at Sophia will not realize that she went through mastectomy. No. Yeah, she's able to move on with her normal life. And sometimes actually the reconstructed breast is even better than the original breast. So you find you find the patients are very, very, very happy. Yeah. And as we do that, we try to match the remaining breast to suit into the reconstructed breast.
All right. Yes. So many questions as far as reconstruction is concerned. Yes. But again, speaking to Sophia, she said, listen, you get, what is it called? 2 for 1. Yes. Something like a lipo. Get a flat
like a tummy tuck.
Yes. Yes. But do you want to take us through, you know, that moment for you, Sophia? And like, when did you decide to? Because again, like so many other women, there's some who would choose, you know, not to, right? But for you, you decided, I mean, upon advice, I want to believe from the specialist. But yes, deciding to go through this journey, and what was that like? I know there's so many people who would ask you, be like, Connie, where's the tummy? Do you find yourself having to explain what happened?
Okay, the selling point was flat tummy. That was the selling point. When the doctor told me about the reconstruction, when he mentioned flat tummy,
that was it.
So, but then he told me to do research on the surgery, so that I can know what they're going to do to me, and then depending on what I feel and about the procedure, I can ask questions. So the next time I went to see the doctors, because there were many, I had so many questions.
What were your initial concerns?
I wanted to know everything, like the procedure, what they will do, how long it will take, like how long will the procedure take, and what, considering the fact that they did it on both breasts, because the first mastectomy, it was just, they left a flat chest. Now on this second one, they are doing a mastectomy together with the reconstruction. So they knew it will take a longer period of time. So they had to explain how that will work well for me, and the period it will take to heal, all that stuff, and how many doctors will be there. Like, I had so many questions. You know, when you're experiencing something new, but you always have something.
And it's important to ask those questions, really.
Yes, I like research, by the way. So I feel, sometimes I feel more, and I have more knowledge than my friends for my age.
And it's good because now you're able to pass that information.
Actually, but I have never talked to my friends, because how do you tell people that you did a plastic surgery and you have a flat tummy?
And you know, there's a lot of stigmas even still, you know, surrounding the same. So
there's a lot of stigma because people don't believe it.
That's true.
And they also think that it's only done abroad, not here in Kenya. But the doctors here are so, they know a lot. Actually, they equipped me with every information, such that by the time I was accepting, apart from the fact of flat tummy, I knew I was in safe hands. I knew this was the best procedure. I knew this was good.
Okay. Did you have concerns, like, for example, because again, you're young, maybe you might want to have kids, and you know, those concerns about, will I be able to, you know, breastfeed? If not, then what is this other like, did you have such concerns?
Okay.
Yeah.
Being 22,
I know.
Having kids was not such much of a priority. My biggest priority was working, making money.
Okay. Okay.
Those are the biggest. Those are my priority things.
Yeah.
But I knew in future I'll want kids and such things. And but I knew that also that even if I had kids in future, I will not breastfeed them. But I'm sure I'd reach that stage. When I reach there, I'm sure there's something that will come up.
There are options, and the Carrie will tell us.
Yeah,
because this might be the same concern for so many, you know, women out there, especially maybe those of us who do not have kids yet, and they've gone through mastectomy and reconstruction. So then, you know, what happens? But again, like you said, we'll cross the bridge when we get there. But for now, the biggest point was to get better,
healed, to get healed, like to be well, to be healthy.
No,
Yeah,
and
that was
totally understandable. Okay, let's speak to mom. So mom, mastectomy was also an option for you, and you had your breast removed. Was it one or both? And my next question was going to be, have you ever considered reconstruction?
Okay, it was only one.
Okay.
The one that was affected.
Yeah.
And it was removed totally. I've never considered that, maybe because of my age and I have more tones. I normally just sleep in a piece of white cloth, or I have this fake breast that I bought. So when I'm going somewhere special, I wear it out. But when I'm in the house, I am just me. I tell my people when they come, when you come to visit me and you are living here with me, I tell you in advance, I have one breast. So don't ask me questions. I show you why I have one breast. So I can just walk around freely with my sleeveless, with one breast, without a bra. Not a big deal for me.
Yeah. And I really like that, because again, through that you're able to educate people, you know, who might not necessarily understand what this is all about. And it's a good thing. And again, listen, you are a motivational speaker. So, but before we even talk about that, like finding meaning, finding purpose, you know, after cancer. So going through this process, and then your daughter is also diagnosed with breast cancer. What was that moment like, you know, for you, and to get hers at, you know, her diagnosis at stage 4?
It was so difficult for me. My going through my first initial stage was not difficult for me as a person.
Yeah.
I just went through it, and at the end of it, I wrote down everything. Writing is my therapy, so I wrote down everything. Can you believe that I didn't know what chemotherapy was? I thought you were put in a machine like radio. So the first time I was waiting to see this big thing that will cover my whole body, I was just given an injection. So you see, I was so ignorant about this thing. So though I flowed through the whole process well, and when I wrote down everything that I had gone through, I never wake up to think, oh, you know, I had cancer, it will come again. I never have those thoughts. But now my daughter coming in was a different thing. It was wary, it was bringing anxiety to me. I didn't know what to do. If given the two options, I would choose to be sick again than being a caregiver. Yes. It is so difficult. I think we have underrated the caregivers and what they go through. They really need also to be attended to, because you are carrying someone who is in pain, who does not know what is coming next, and they are depending on you, and you are there being strong for them. You get?
Yeah.
And yet you are supposed to be crying or feeling their pain. So it is really, really hard to be a caregiver. So for me to start again, I was like, God, what have I done? Have you forgotten us? Must I go through it again? I saw it from my perspective. I saw it like I was going through it again. And worst of all, it was the right breast. Willie's breast was the right one, and mine was left. So I was telling God, now you are completing me. You see? And I would go to pray, and just sit there and cry.
Yeah.
Or when I'm showering, I just cry. And then when I come out, I have to wipe my tears and be strong. You see?
Yeah.
So that balance is very hard.
Yeah.
And then you are anxious. And this thing had been there from the time she was about 13, 14. We didn't know because we were advised it's not cancerous, it is just normal, and it is true, it is normal. But now it has now turned not to be normal. So like, could I have done something before that? Where would I have maybe changed the situation? So you ask yourself this question: will she be able to go through it? But thank God, she's a very strong woman.
Yeah.
She gives you hope even when you are hopeless.
Yeah.
But I treated the time like if someone called me at night, I would just panic. I rush from my phone and I'm panicking like, what is happening now?
Because you don't know what is
happening. Has happened now?
Yeah.
Yeah.
I mean, yeah.
It's not a good thing to be a caregiver.
No, that's true. That's true. I mean, like they say, when one member of a family is sick, we all get sick because we feel their pain. We want to do things that will make their pain or ease their pain. But sometimes some things are just beyond our control. Bure, I know you were very... And like you said this in one of the interviews, and you said it got to a point where you did not want anyone to tell you you're strong because, you know, there are those moments where you don't even know what strength means at this time, you know, going through the entire process. But Mom is here, gave you the kind of support that she could at that time. But did it ever get to a point where you considered, you know what, can we just get both breasts removed to ease your pain? Because now you have another lesion in your brain. It's like dealing with all those things at the same time. Like, did you ever get to that point?
Yes, Winnie, a month ago, I was ready to die.
Oh, wow.
The kind of pain I was experiencing and the kind of struggles I was going through, losing my vision partly, throwing up all over the place. I couldn't walk in a straight line. Like, I start knowing that I want to go somewhere and my brain just wouldn't function. I would totally go in the opposite direction. I had absolutely no balance. And I'm thinking, why am I even going through this? Like, God must really, like, it was humorous because how could I be receiving treatment, doing everything it is that's required of me, and have the situation get worse? I just couldn't understand. And it was one of the hardest times of my life, these past 2 months. But I found the strength to get up when I saw everyone around me. And I knew this is not only for me, it is also for the people that started this journey with me off social media and on social media. I quickly discovered this is not just for me. And so I have to get up and get out of this grave. And the moment I flipped my mind, that's why I say I believe in affirmations. When you cheat your brain, you can do absolutely anything.
Absolutely.
If you looked at me today, you wouldn't know a month or two ago I was ready to die. Like if God had come knocking and say, hey, so do you want to cross over or you want to hang around a bit? I'll say, please take me.
Get me on the other side. I see that. I see that. Yeah. But you're here today and you're sharing your story, and Mom is here as well, having gone through you know, the journey together and supporting one another. That goes a long way to say how important support is. Listen, we have to literally like end the show right now. But I know time really flies. But Sophia, I'd also want you to speak very quickly in like 30 seconds, right? And this is as far as, yes, even after going through reconstruction, what is life like? How are you doing right now? Do you have any concerns? And then we'll close with Nectar.
Okay, after the reconstruction, after the healing, wow, you feel nice. You feel complete. Like now I can walk. I don't have to use prosthesis anymore. I just have to be myself. Even if somebody asks me how I got to Flatami, I don't know how to explain, but having such a platform makes me feel nice to tell people about it, because I would like people to consider the idea of having the reconstruction, because it feels nice. You feel motivated, and you also feel motivated to motivate others.
Absolutely.
Yeah.
And you're here today. And Dr. Ari, again, what would you say? I know we need to end the conversation, but really, as far as what to understand as far as reconstruction is concerned, 30 seconds.
Yeah. So I think what I will say is that reconstructive surgery is readily available in this country.
Yeah.
Actually, we've got plastic surgeons almost in all major cities or major big towns in this country. And anybody going through mastectomy should always ask his doctor or her doctor about the options of reconstruction. It makes such a big difference in the lives of the patients.
Yeah, absolutely. I mean, look at Sophia. She's here smiling at all those things. Thank you so much, Dr. Ari. And again, for Bure and Mom, please allow me to say thank you. I know, Bure, you're doing 31 days of Pink, which is a good thing. So head over to her platform and get to understand what it's all about and how you can chip in. And Mom, again, continue to spread, awareness, number one, but also encouraging as many people out there as far as, number one, understanding cancer, but also offering support. So thank you so much to both of you, all the way from Mombasa, for joining into the conversation this morning. Really, really appreciate your time. And Dr. Ari as well, thank you so much. Sophia, thank you. Thank you so much for also agreeing to come and speak with us this morning. All right, so we have to end the conversation here, but it does not end here. Let's keep it going on our socials, and that is at NTV Kenya, both on Facebook and on X, and get to understand more as far as reconstruction or reconstructive surgery is concerned, and ask all those questions that you have. We'll fill them to Dr. Ari. But for now, have yourselves a lovely day ahead. I will see you tomorrow morning, same time, same place, right here on Your World. But until then, stay safe and God bless.